Overall, cancer deaths in the United States have gone down for the past 2 decades, thanks in part to immunotherapy and specialized therapies. But those life-saving treatments sometimes come with a cost. In HealthWatch, Shelley Botat has more on an emerging medical subspecialty that helps the body's largest organ during cancer care.
These are really lovely plants.
At 78, George Handy still does the landscaping at his suburban D.C. home. Yard work and 25 years in the Army meant he was outdoors in the sun for hours on end.
I'm fair-skinned. I grew up in a time when nobody really worried about skin damage.
But in July of 2018, unusual changes to his scalp took a life-threatening turn.
It started as skin cancer. It ended up as neck cancer.
George had surgery, 6 chemo treatments, and 6 full weeks of radiation. The treatments knocked cancer into remission. But then this, 2 horrible rashes, one diagnosed as radiation dermatitis.
Looks like acne. It is utterly miserable.
Dermatologist Adam Friedman is one of a handful of U.S. experts practicing supportive oncodermatology, dermatologists who treat the skin-related side effects of cancer treatments, like targeted therapies.
Very often, oncologists will stop or lower treatment courses because of these skin side effects. So if I can prevent that and get a patient through their course to treat and possibly cure their cancer, that is of the utmost importance. Definitely a lot better. Also, your cheeks are looking a lot better.
In George's case, Dr. Friedman prescribed a medication and topical cream for the rash, letting him spend more quality time with his wife Marilyn and the people he loves most. Dr. Friedman says some of the other common side effects they treat include infections, severely dry and itchy skin, brittle or lost nails, and changes to hair. There are about 10 other major medical centers offering supportive oncodermatology. And that's your Health Watch. I'm Shelley Botat, Local 5 News.